We do believe in least government intervention as possible, and we also believe in having ownership over what we put into our bodies. And that's been, those are kind of American values that we've always had since the beginning. They're going through all of the things, the possible risks, complications, anticipated benefits involving the treatment, and recognize possible alternative forms, including non-treatment. If you're advertising, don't make any crazy claims, but if you do, it needs to be clearly legible in a font size no smaller than the largest font size used in the advertisement, that this is clearly spoken. Originally, we thought stem cells, when you get the injection, it triggered your body's own stem cell proliferation for about maybe 6 months, and that's kind of the standard. But she found in the healthier that patients were, it was up to a year where there is regeneration, and we see on average about a 2 millimeter improvement in thickness of cartilage.
Welcome, everybody, to the Health Accelerator Challenges. This is your host, Cade Archibald, and really excited. We got some awesome topics we're going to be covering today. And along with me, we got Regan Archibald. Regan, how's it going?
Good. Yeah, really fun day here, and I'm excited for us to dive in today because I don't know if you guys follow the news. I know I don't, unless it's something like really groundbreaking. Usually mom will text me like, how do you not watch the news? How do you want? And I'm like, why? The world's been better. Like Dan Sullivan, the world's been better since I stopped watching the news. It's like everything's better. So, but we had a new bill that was passed, Senate Bill 199 in Utah, that has now, starting May 1st, it legalizes non-FDA approved stem cell therapy. So it's one of the biggest breakthroughs in medicine. Utah is one of the first states to be progressive about this and say, hey, these therapies are life-changing, and we want to make sure that as long as doctors are letting patients know that, hey, talk to your physician about this, there's got to be consent for care. These are not FDA approved treatments, which we've talked about for years. But yeah, for nearly 14 years, we've been working on this, and now it's actually, Utah is one of the first states. And so I think it'll be a precedent that will be set throughout the United States. But the Senate bill did pass February 29th, and I'm really excited about it.
Yeah, it is incredible. Like, it just incredible news on the stem cell front and stem cell community. And yeah, really, really exciting.
Yeah. And so we'll kind of dive into that a little bit today. I want to talk about some of the reasons why it's such a big deal. And then I want to hear from each one of you. So many of you have had these therapies, and the House Bill 199, as we go through it, we'll kind of talk about the nuances and what it means, but it specifically pertains to peptides, placental or perinatal stem cells. So that's it's what many of you have had. And so I want to hear what your experiences have been with it as we talk about this. Just take a minute to thank everybody who was there pushing that new approval through. It's really exciting because I think for so long, especially if you think about what we endured during 2020 and the rollout of the new vaccine and kind of this lack of scientific data, but almost like an enforcement of getting a vaccine. I think the thing that happened after COVID is a lot of us we realized like there's so many injuries that have happened from the vaccine itself that we said, hey, we want to be able to choose what we put into our body. And one of the beautiful things about the culture here in Utah is we do believe in less as least government intervention as possible. And we also believe in having ownership over what we put into our bodies. And that's been, those are kind of American values that we've always had since the beginning. Benjamin Rush was the doctor of George Washington for a time. And Benjamin Rush was also there, kind of an influencing voice with the founding fathers. And he said, hey, if we don't put medical freedom in the Constitution, if you don't protect the doctor and patient relationship, then you can have a dictatorship based on medicine alone. And this was, back in the 1700s. And so, because he saw how dangerous it was even in Europe when the government actually has control over medicine. And we saw that during COVID, but now Utah, I think, is one of the first states to say, hey, this tissue there's a lot of research behind it and it's helped a lot of people. Let's just make that available. And as long as the doctors are playing by the rules, they're not, doing some kind of crazy claims of, curing, cancer, Alzheimer's, things like that. As long as there's no, kind of fraudulent practices going on, and they think that it will lead to better therapies, better health, so that's some exciting news. But I want to hear from you guys because how many of you guys have actually think that's really good news? You could maybe raise your hand or in the chat box, you can plug in your experience that you've had with it because I know a lot of you have seen massive improvements in knees and I've seen it in my brain, my back, everything. It's just it's been exciting. So yeah, a lot of hands coming up here. But Cade, what were your thoughts when I first shared that with you?
It was it just like a lot of excitement and optimism for like the future because I think historically medical boards have kind of been silent on the whole regenerative medicine and some of those tissue allografts, and so just to see them say no, this is something we're going to back and we want to make sure this is something that's available is really exciting. I think just really really stoked.
Yes, awesome, cool. Well, and awesome, Matt. Good to have you. And thanks for sharing that, Matt. Matt says, just got a second set of injections yesterday. My knees have less swelling, less inflammation, especially noticeable when you drive longer than a few hours. Used to have difficulty walking when they stiffened up. That's awesome, Matt. And I've noticed the same. I did my left knee for a meniscal tear, and it made such a big difference. I noticed within 3 days, I could balance on that leg again. I could walk up and down stairs, and it's made a huge difference. So let's jump into the bill a little bit here because this is it, and they call it placental tissue amendments. And that this was the chief sponsor was Curtis Bramble, and the House sponsor Katie Hall. And you can see that that it requires certain health providers to provide certain disclosures when administering treatment using placental stem cells. And essentially, the bill goes through, and you guys can look this up. I won't talk about all the nuances of it, but the human cells, tissues, or cellular tissue-based product has the same meaning. They're basically defining it. Stem cell therapy means treatment involving the use of afterbirth placental perinatal stem cells or human cells, tissues, or cellular tissue-based products. So this does not include like other animals, because I know in some places like in Mexico or when you leave the United States, that means you could be getting stem cells from a different source. Stem cell therapy does not include treatment or research using human cells or tissues that were derived from a fetus or embryo after an abortion. So just so everyone knows, this is tissue that would just get thrown away. And after deploying, we've done over 25,000 of these and had a phenomenal success rate, a high level of efficacy, and very high level of safety. But it does not include embryonic stem cells. Those are pluripotent stem cells, and they just want to grow a baby, and so those stem cells can be very aggressive. And so it also is for the scope of practice includes the use of stem cell therapy. May perform stem cell therapy that is not approved by the United States Food and Drug Administration if the healthcare provider provides the patient with the following written notice, and this notice must be provided to you under Utah law. And so that's the consent to care. You'll be encouraged to consult with your primary care provider before undergoing a stem cell therapy. Written notice described shall be on paper at least 8 1/2 inches by 11 inches. So piece of paper, which we do, written in no less than 40-point type. I like how detailed it is, Cade, because then it gives us clarity. It's the roadmaps. Healthcare providers required to provide written notice under the subsection 2 shall obtain signed consent before performing the therapy, signed by the patient. If the patient's not legally competent, the patient's representative in a language that works. So they're going through all of the things, the possible risks, complications, anticipated benefits involving the treatment, and recognize possible alternative forms, including a non-treatment. And so if you're advertising, don't make any crazy claims, like I mentioned before. But if you do, it needs to be clearly legible in a font size no smaller than the largest font size used in the advertisement. That this is, it's clearly spoken. And I'm assuming there's no claims there. The healthcare provider who has obtained approval for investigational new drug, they need to list that out as well. So, if you have clinical trials, and then they talk about how to market it if you do have clinical trials. So kind of some interesting things there. But I know we've had some questions come through. But yes,
Yeah, so
uh, go
we
ahead,
had
Kit.
we had a question from Hugh. How does this change East-West services? And so Reagan's fixing his lighting here. But yeah, ultimately, how it changes our services, not a significant change, other than it's just really exciting to see that this is actually opening up, and the FDA is not I obviously put any FDA approvals on any of these treatments. They've actually made some stances against stem cells in a lot of instances, but what this means for the state of Utah specifically is they're protecting that for patients. So you can actually go through these procedures and not have to worry about FDA intervention. And same for the medical providers providing these services.
Yes, and then Dean and Hewitt does. The great thing about these treatments is they do seem to be more lasting than any other treatments that we deploy. But it does take time because some of the research that we've done in our Go Wellness community, we had a doctor that would actually had looked at injections she did in the knees, and she wanted to see if that patient's body could regenerate the cartilage and how long the regenerative process would happen. And she found that, originally we thought stem cells, when you get the injection, it triggered your body's own stem cell proliferation for about maybe 6 months, and that's kind of the standard. But she found in the healthier that patients were, it was up to a year where there is regeneration, and we see on average about a 2 millimeter improvement in thickness of cartilage. So there's some like really cool things that can happen. And so you're right, it can be slow, but as the old saying goes, slow is smooth and smooth is fast. And so we like to fix things for good, even if it takes a little longer. But what we find is about 80% of the people who receive therapies, they notice a reduction in pain, alleviation of certain symptoms within about 30 days. And we'll get Dr. Steinley on here to talk about it. Our functional medicine, regenerative medicine nurse practitioner, doctor of nursing, she would know those stats better, but from our data, that's what it looks like. So, yeah, pretty darn awesome. And then Dean said, are these injections, are they jump-starting the production of stem cells? Answer, okay. But yes, Dean, so you're onto it because really with stem cell therapy, when you're considering perinatal stem cells, a lot of us, we think, well, those stem cells are going in and they're just going to be like forming into a specific tissue matrix and they're going to become engrafted into your body. But actually, what we've learned is these are our mesenchymal stem cells are also considered medicinal signaling cells. And so they're actually triggering your body's own production of stem cells because you have all these quiescent stem cells in your body. And when you put these young stem cells in there, they wake up all those old stem cells, and then you start getting your body's own production of those cells. There's specific cytokines, there's growth factors. There's a really important growth factor called VEGF, and it's a vascular endothelial growth factor. And that VEGF can be really important for regenerating blood vessels that are typically damaged with degeneration. And so essentially, these treatments, they're influencing your body's own healing regeneration that already exists. So yeah, great questions there. Yeah, definitely cost effective, Hugh, and much less expensive than when we first started doing it. When I first had my shoulder injection, the cost was about three times more, about 300% more expensive than it is now, or 400% more. Yeah, so very exciting. All good things, and I think that's how innovations go. When we were looking at this in Utah, we were one of the first clinics to start using these tissues, and there wasn't really a lot of guidance. It was kind of like, well, there's some off-label usage of these, but there's no FDA approvals for anything, and there is some great research because there's these perinatal tissues have been used for well, even in Chinese medicine, they were used for different sources, but primarily for regenerating the mother. They would eat their placenta. I know it sounds kind of weird, but that's what. And then there's an empress in China, and it was called the purple pill, and she would eat placenta every day. Kind of weird because she wanted to live forever, and so. Just imagine. And then in China, there's been kind of this weird underground market for a long time in like the 80s and 90s where they were selling placentas. And I still think it might happen some, but it's a very big piece of Chinese medicine. But women now, if you work with the right midwife, you can encapsulate your placenta and use it that way. Or Cade may make pancakes out of the placenta. I don't know if you did that when Sierra gave.
We didn't grill them up, no.
No
Uh,
placental pancakes.
Definitely encapsulated them, and then like that was the thing with Sierra. Her recovery on her last pregnancy when we did that was like game changer. Yeah.
Yeah, it's crazy. I mean, if you think about kind of the origins of it, I had my shoulder injury. This was about 12 years ago, and a full thickness tear in my rotator cuff. My scapula was fractured. Splintered my labrum. My whole shoulder needed massive surgery. But I just saw that the challenge of that was getting surgery not only would I be out of work for a couple of months, but then the ability for it to fully heal was like 50-50 is what the research showed and what the surgeon, said. And so I was like, I don't want to take that risk. I don't want the time off. So, ended up like looking around in Utah, and I'm like, no one's doing stem cell therapy. And the only people that I could even find are people using bone marrow. But then I found out that there are some doctors out of Texas using perinatal tissue or placental stem cells for, their patients. And I said, all right. And they're using it, for different injuries. So I called them up and they said, yeah, we'll send you a vial. And so I ordered some and had one of our doctors at the time inject my shoulder. And the first 3 days, I didn't notice anything. To your point, Hugh, sometimes it takes a little time. But then that third night, I went to bed and slept through the night. And I was like, something's working. And then it just started getting better and better. And there's some weeks where it wouldn't, then it'd get better again. And by about the 6 month mark, it was just as good as it was before the accident. And I didn't really trust it. And so a few years later, I tore my other rotator cuff skateboarding. And then I was like, okay, it worked again for that shoulder. And then I did it Then I tore both rotator cuffs skiing, and it worked that time too. So I've had four rotator cuff tears that 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 it's helped with. So yeah, pretty amazing. Um, Good. Looks like we have another question from Gary. Good to have you on. I had exosome and stem cell injection in my penis years ago. Have there been any advances lately in the P shot? So, just so those of you know that if you are in, the regenerative medicine space, sexual wellness, then there's definitely some benefits that we've seen in the P shot. And there has been a quite a bit of advancement as far as the post care that we found, Gary, for some of the for like the P shot injection. There's peptides, there's ozone therapy that we're finding that just influences stem cells, and also what we've seen is, the FDA in 21, the end of 21, they closed down like 90% of the labs that were making these major claims. And a lot of the labs, when we tested their stem cell product, we found that there just wasn't the quantity of live stem cells. And in some cases, it was just proteins. I'd go with Elliott Spencer Cade, and we had the flow cytometry, and I would test these, and we'd find that there just wasn't, you're not getting what you thought you were. And so I don't know, Gary, if I don't know what product you're using, but we do know that the advancements, from the treatments that I got in my shoulder from the perinatal tissue, we were happy to have about 1 million cells that would survive post-thaw. The attrition rate was like 90%. And now we're seeing like 40 to even 50 million, with the way that the stem cells are processed. So to say there have been advancements would be an understatement.
Significant advancements.
Yeah, significant. So certainly, I don't know how things are working down there, but there could be some awesome opportunities for you. Matt says you need to find some new, less injury-prone sports. Hey, so do you, buddy. We do the same sports. So mountain biking is the other place where we've had some great injuries thanks to Cade. Um, but
Yes.
and Todd, good to have you on. Regan, Cade, I have a friend whose knees were trashed, so he did stem cells, felt great within 2 days, and then he immediately went back to squats, but within months, his knees were back to where they were. So what should the full recovery time be before getting active again? And I think this is kind of dependent on what Amy shares, because I think the worst thing he did is he probably put too much stress on the stem cells and he didn't let his knees recover. In general, it's about a 30-day window where you want to let the stem cells start to like promote all the healing properties in the knees. And so my guess is that he probably increased the inflammation in the knees far too quickly. On the other side, you don't want to be sedentary after you get stem cells. You want to get back to, being active, but we say only push yourself to about 60 to 70% within that first month. So Matt, I hope you're listening because, we want your knees around for the next 100 years. And so, make sure that, for the next 30 days, you're not pushing it too hard, 60, 70%. So Todd, that your friend needs to go back and get a booster, and his knees will, because he's still got the life in there. He just needs to get either ozone, or we'll do PRP, or even alpha-2 macroglobulin is a phenomenal treatment, because what happens is a lot of people don't remove the arthritic response in the joints themselves. And so even though you have great stem cells in there, and the stem cells help create cushioning, and there is some hyaluronic acid in there. But the other thing is, you're going to also see that if you don't get rid of the proteases that are driving that response, and that's where alpha-2 macroglobulin is a way where we take these globulins and these proteins out of your blood, and then we inject it into the joint. It turns off that arthritic response. And so that could be the other reason. Have him give us a call. We'd be more than happy to help. So yeah, so if he's going back for more, that's great. Just have him do alpha-2 macroglobulin if he has arthritis. I don't know his medical history, so awesome. Yeah, so there's so many cool benefits. We did the brain rejuvenation retreat with Ben Greenfield a couple weeks ago. That was massively successful. I think the biggest thing we heard from that is just a nasal mist, but biggest thing we're hearing is that people can see better and they're noticing that they have more mental clarity, less brain fog, and we've even had people say that they feel smarter, and so that's definitely. That's huge. We can't guarantee any IQ improvements, but the research is pretty interesting. Just using a nasal application, there's so many great aspects to this. The other interesting thing, the other big thing that we've been doing that we've talked about here a little bit is using some of the cord blood plasma. And the cord blood plasma is just, you do 10 injections, typically daily. You could space it out as much as a week. But what that does is it cleans out the blood plasma. And Cade, maybe you could describe a little bit about your understanding of it, because I know you had an opportunity to talk about that today. And so, but yeah,
Yeah.
tell us that.
Yeah, and I think one of the procedures that is kind of big in the age reversal medicine area is the plasmapheresis. So that's where it's a pretty long and fair, it's a little bit painful as well, but it's about a 4 hour procedure. They're taking out your blood and then stripping out the plasma and replacing it with new plasma. And so that's a great treatment for age reversal. Been some great studies on Alzheimer's with that as well. And seeing great things, but it's a huge investment. Cost on that's anywhere from 50 to 100K just for plasmapheresis, a one-time treatment. And so there's some new studies out on just subcutaneous injections of umbilical cord plasma that we're seeing some similar effects. And so when you look at it's a lot more cost effective as well as less painful. The time under there's virtually no time. It's similar to taking your peptides in the morning. You draw a little syringe and you do a sub-Q injection there. It's nice and simple as far as that goes. And yeah, seeing some age reversal markers improve, inflammatory markers improve. You're just creating new plasma in your bloodstream. So it just a really incredible treatment.
Yeah, and I think especially for people who have, where the immune system is just where either the peptides don't quite land right or the immune system seems a little beat up. One of the things that this therapy does is it helps remove out the debris or it removes the interferences. So it's the best way to detox the lymphatic system, and it's not talked about a lot. But we're seeing just like these kind of people who haven't responded exactly the way we'd want them to. We get that cord plasma, and now we're starting to see things just like the needle moves just a little bit better. So super excited about that. And this is the nice thing, because there's even exosomes that come from the placental tissue. So if you think about how dynamic this is. It's the same material that allowed us to form in our mother's womb. And if you just go back in time and you say, man, what's the most natural agents we can use? Because I've always looked at like, what are the things that have the highest level of efficacy and the highest safety profile, but they're going to get people healthy in the least amount of time possible. And that's one of the reasons I've been obsessed with peptides, because we've seen so many great things by turning on those peptide pathways. But the other thing I found is, and probably even more so, is that these perinatal tissue allografts, or these stem cells that come from the umbilical cord, the placental tissue, they're so multifaceted. And so, some of the things we talked about today are the growth factors, the cytokines. We talked about the stem cells. We talked about the exosomes. We talked about the fact they have these peptide structures. There's 261 naturally occurring peptides. We talked about even the cord blood. One of the treatments that you can use cord blood for that's well documented is for people who have leukemia or kids specifically. And so now we're seeing that, man, this cord blood plasma, if you take it through a centrifuge and just isolate the plasma, we're seeing massive changes in the body's ability to become younger just by reducing those inflammatory cytokines, by clearing out the old blood. So this is how you can get some young blood. Um, it's an easy solution to it without the risks of the plasmapheresis, and very well tolerated, easy injection. You just do it the same way you do peptides, just insulin syringe, and super simple. There's so many phenomenal things going on that I'm so excited. And this tissue is kind of like the anchor of all healing in the body. I mean, it's just it's so dynamic. And now we're just going to learn more and more about it, and we'll have clinical opportunities to share with each other about the results that we're getting. So how cool.
Very cool. Any, Reagan, what would you say is like the most exciting study or most recent thing? I know we've talked a lot about the cord plasma. Anything recent that you've seen that's really promising?
With plasma.
Studies around stem cell therapy.
Yeah, there's a bunch. One study that I was just reading about, this was 30 patients who had either grade 2 or grade 3 or stage 2 or stage 3 osteoarthritis in their knees, and they received an intra-articular injection of either 5 million or 10 million mesenchymal stem cells. So pretty, like, not a high dose. And what they found is on the outcomes, they looked at it, the pain scores at 12 weeks, 24 weeks, 36 weeks, and 52 weeks post-injection. And they found that there is significant reduction observed at all time points compared to baseline. So remember, 52 weeks is a year later. That's phenomenal.
Yeah.
But they did find that they had a greater effect with the 10 million cell dose. So in that case, it's like, yeah, they did find more is better. There's another study that showed if you do more than about 100 million in one area, it has diminishing returns. So it's not like more is better. So I think a lot of people they go and they leave the country and they get all these induced stem cells, and you grow your stem cells for a certain period of time and then you get them re-injected. And I just haven't seen that the results have been any better than what we get here, where we don't mess with it at all. Because it's a lot safer if you're not doing, stem cells that have been cultured. And so this is a perfect study that shows that. They did MRIs and they found that there was reduced symptoms of cartilage degeneration and increased cartilage volume. There's no adverse events reported. I mean, this is 30 patients, but yeah, that's pretty amazing. So that's one of the studies. There's another study.
There's endless studies there. It seems like recently. That's why I like to ask, is what's the coolest one? So that's awesome.
Yeah. Okay. Yeah, I think that one probably is the most exciting. I mean, yeah. So here's what we've learned about this. It's not a panacea. And one of the things you'll find in the studies is if you just try to isolate it and do this double-blind study, there's always a placebo effect in everything in medicine. But there is in surgery too. I mean, even in surgical cases where people get the sham surgery where they just cut them open and then seal them back up, you can look up sham surgery for meniscal tears, and people will get out of the surgery and they'll think they got operated on. They'll be walking just normal, and they're like, "Yeah, I'm healed up." And they're like, "Well, you actually didn't get your knee operated on." They're like, "Yes, I did. I got the scar right here to prove it." And it's like, "No, you were in the sham group." And they'll be like, "What?" They'll just like break down and like so. So I think there's so many things with healing that but what I look at is that this tissue, the stem cells from umbilical cords, is just such a magical piece of nature. And so, it's the same, it's basically like taking us back in time, it's reversing the clock and sending us back in time so that we can actually have this nice regenerative impact. And, there's great regenerative properties. We've seen it reduce pain and swelling. We've seen it slow disease progression. We don't see crazy things where if you have Parkinson's, it's not going to reverse your disease. It's not going to cure things. But what it does is if you can catch things early, if you have a little bit of pain now, get on top of it because that's where this medicine really shines. If you got bone on bone and your knees like you can barely move, you're waiting too long. And I think that's the most foolish thing that we do in our culture is we ignore the pain and we wait until things are really severe before we do something about it. But with these tissue allografts, with these umbilical cord stem cells, the sooner you can get on it, the better. And it's not like you just do it once and then you're done for life, but you want to think about, continually rejuvenating your body, whether that's with, some kind of, treatments that you do for the brain or the body. But there's great ways that you can continually rejuvenate yourself. I had a policy that I made on my last birthday. I said, pain is not getting free rent from me anymore. I said, I'm getting rid of all my pain 100%. And it's made such a difference. I got the full body MRI. I found out any areas that could be suspect. I treated those. And I can't believe how much better that I feel because of that. And so I'd encourage everybody to, do a quick inventory. And this is your challenge for the week. Just do a quick inventory and say, man, if there's some area that could be improved, what would that be? And then just start slowly working on those things. And then, if you need some help, we're here. We reach out. Well, we'd love to help you out.
Love that. Awesome. Well, thank you so much, Regan. Amazing content as always, and really, really exciting stuff happening in the world of stem cell therapy, research, advancement, so many cool things. So thank you for all you do.
Awesome. You got it. Thanks everybody for being part of the community here at East West. Really appreciate you guys.
Yeah, and if you have a loved one or anyone that you think could benefit from these Health Accelerator challenges or our Unreasonable Health podcast, share this with them, and let's help some people out. You can find more out about this at acueastwest.com/hack. That's HAC. Thanks, everybody. Have a great day.
Thanks, guys.